Have you ever wondered what actually happens deep inside your lungs during a dive, especially when you ascend too quickly or use the wrong breathing technique? It's a world of hidden dangers, and one of the most critical is something called arterial gas embolism, or AGE. What exactly is this silent threat, and how can we protect ourselves from it? To understand arterial gas embolism, let's take a journey deep inside our lungs, the incredible organs responsible for breathing. Imagine flying gently into your air pipe, down through the branching airways, past tiny, waving cilia, until we reach millions of microscopic air sacs called alveoli. These delicate structures are where the magic happens. Vital gas exchange. Their walls are incredibly thin, just one cell thick, allowing oxygen to effortlessly pass into your blood and carbon dioxide to leave. But this very fragility, which makes them so efficient, also makes them incredibly vulnerable, especially to pressure changes. Now, imagine a diver ascending rapidly from the depths. As he ascends and the surrounding pressure decreases, the gas volume in his lungs expands rapidly according to Boyle's law. If the diver ascend too fast, or worse, hold his breath, the pressure within these tiny alveoli can become too high, far more than their delicate walls can handle. We see them stretch, tremble, and strain to their limit. Then, in a dramatic, slow-motion moment, microtears appear. An alveolus ruptures because of the high pressure. And tragically, a nearby blood vessel tears too because of the alveoli stretching it to its limits. With a muffled pressure pop, air bursts violently into the bloodstream. This is pulmonary barotrauma, the dangerous event where air enters directly into your arteries. These tiny air bubbles, reflective and spherical, begin their perilous journey. They multiply, drifting trough the bloodstream, surrounded by red blood cells. Even the smallest bubbles can merge and block the delicate vessels in critical organs. They rush through the arterial system, like a tunnel filled with swirling plasma and red blood cells, propelled by each heartbeat. These air bubbles are unpredictable. They can travel to the brain, the heart, or other vital tissues, lodging anywhere. When these bubbles get too big or encounter a narrower artery, they collide, cluster, and form a blockage, an embolism. Red blood cells piling up before the blockage, flow becomes less and slows dramatically. This blocked blood flow means oxygen cannot reach the tissue behind it, and cells begin to die within minutes. The effects can be devastating. Within minutes of surfacing, symptoms often appear, resembling a stroke or heart emergency. When air bubbles get stuck in the brain, they block the blood and oxygen supply. That part of the brain suddenly receives no oxygen, causing the brain cells to stop functioning almost immediately. If air bubbles get stuck in the heart, they can cause serious problems like chest pain or arrhythmias. And in severe cases, it can lead to collapse and unconsciousness of the diver. Note: a diver who is unconscious at the surface is presumed to have an arterial gas embolism until proven otherwise. An arterial gas embolism demands immediate and decisive action. Every second lost increases the risk of permanent damage or death. So, what do we do if we suspect arterial gas embolism? First aid is crucial and time-sensitive. Step 1. Immediately call emergency services, 112, or your local equivalent. Step 2. Give the patient 100% oxygen, 10 to 12 liters per minute. Oxygen helps accelerate the shrinking of those dangerous air bubbles and supports damaged tissue. Step 3. Monitor breathing, airway, and circulation. If the diver is unconscious, place them in the recovery position. Step 4. If there's no breathing or pulse, begin CPR immediately. Finally, the patient must be transported to a hyperbaric chamber. Hyperbaric oxygen therapy is the primary and most effective treatment, where increased pressure dramatically shrinks the bubbles. The good news is, arterial gas embolism is almost always preventable. Remember these 3 simple rules. 1. Always ascend slowly. 2. Never hold your breath while ascending. 3. Maintain good buoyancy control. Stay calm, keep breathing, and ascend safely. Understanding arterial gas embolism is the first step to preventing it and ensuring a safe dive.